Let's just dive right into this explainer. Today, we're systematically breaking down pediatric acute musculoskeletal injuries. Look, if you've ever felt that wave of panic trying to figure out if a kid just has a simple playground bump or if it's an actual, true orthopedic emergency, well, you're in exactly the right place. We're going to get you totally ready to crush your clinicals. So, here's our clinical blueprint for the day. We've got 5 sections to march through: contusions, joint dislocations, sprains versus strains, overuse injuries, and finally, assistive devices. For every single one of these, we're hitting the pathophysiology, the risk factors, and your absolute top-tier nursing priorities. All right, Section 1, contusions and neurovascular basics. We're starting off at the mildest end of the severity escalator here with contusions, which, your patients will just call bruises. The pathophysiology for this is pretty straightforward. You've got trauma that damages the capillaries, and that creates bleeding and discoloration right under the skin. Just picture a toddler constantly bumping their shins on a coffee table while they're learning to walk. It's totally expected, right? Just normal childhood stuff. But as nurses, we always have to look a little deeper than the surface. Because there's a massive difference between a routine finding and a major red flag. Now, a normal contusion, that fades predictably. It goes from that bluish-purple color to a greenish-yellow over a few weeks. But what if you see unexplained bruising? Or maybe bruises shaped like specific objects, or bruises in multiple different stages of healing. Or honestly, any bruising on an infant who isn't even crawling yet? That is a huge red flag. It requires immediate investigation for things like non-accidental trauma, underlying clotting disorders, or vitamin deficiencies. The absolute most crucial takeaway here is to never, ever ignore bruising that just seems to happen way too easily. This is a critical safety alert. It is literally our job to advocate for the child and escalate these findings. They can point to some really severe systemic issues or environmental dangers that we just can't miss. And honestly, whether we're talking about a simple bruise or a massive fracture, whenever you assess any of these injuries, you have to perform a baseline neurovascular assessment to rule out true emergencies. You're checking sensation, making sure there's absolutely no numbness or tingling. You're verifying the skin is warm and normally pigmented distal to the injury. You want to see that capillary refill coming back in under 3 seconds. And of course, checking that pulses are palpable, strong, and bilaterally equal, and making sure the patient can actually move the joints distal to the injury. You've got to master this checklist, guys. It is the absolute foundation of musculoskeletal nursing care. Okay, moving on to Section 2, pediatric joint dislocations. Let's step up the severity a bit and talk about joints. So, a dislocation happens when 2 bones literally come apart at a joint, which can unfortunately tear the surrounding ligaments. And children, they are uniquely at risk here. They have this increased joint laxity. Sometimes it feels like they literally have rubber bands for ligaments. Plus, their muscles are still developing. We tend to see this a lot more frequently in older kids, adolescents who are into extreme sports, males, and very notably in clients with connective tissue disorders, like Ehlers-Danlos syndrome. Now here is where you really have to prioritize your clinical findings. A visible deformity, tons of swelling and pain. Yes, those are terrible for the patient, but they're actually the expected hallmark findings of a dislocation. But what if you find paresthesia, or unequal color, temperature, or pulses bilaterally? That is a neurovascular deficit. That right there is the true limb-threatening emergency that you must catch on an exam and escalate immediately. No exceptions. As for your nursing priorities, you need to provide ice, elevation, and splinting to immobilize the area. But please hear this loud and clear. Never, ever attempt to move or reduce the joint yourself. Any kind of manipulation risks causing additional permanent nerve or blood vessel damage. You secure it exactly as is, and you wait for a provider to do a reduction or surgical correction. Which brings us to Section 3, sprains, strains, and management. Let's tackle a classic exam trap, differentiating these 2 anatomically distinct beasts. Think of this as your ultimate cheat sheet for test day. A sprain is an injury to a ligament, so bone to bone. It usually happens from a twisting motion or a direct impact, and the pain is immediate. Bam! Now, a strain, on the other hand, is an injury to a muscle or a tendon, so muscle to bone. This is often from overstretching or overuse, and the pain, it might develop gradually. Confusing a strain's gradual onset with a sprain's immediate pain is such a common pitfall, so make sure you lock these differences down. Moving over to treatment, you really need to understand how the classic PRICE mnemonic contrasts with the modern police protocol. I mean, you've definitely heard of PRICE, right? Protection, rest, ice, compression, elevation. It's a classic. But contemporary sports medicine has evolved quite a bit. Modern treatment now actually favors police, which swaps out rest for optimal loading. So, why the change? Well, we've learned that early, controlled, and graduated weight bearing actually supports tissue healing way better than complete, strict immobilization. You really need to know both acronyms for your exams, since police represents the absolute most current evidence based practice. All right, Section 4 Pediatric Overuse Injuries. Moving from acute traumas to chronic stress, let's explore some issues that are incredibly common in active, growing kids. The pathophysiology here is all about repetitive stress. It's high-intensity movement combined with poor body mechanics, completely outpacing the body's ability to recover. Children between 6 and 18 are especially vulnerable. We're talking about kids playing year-round travel sports or pushing through weekend double fitters without taking at least one full rest day a week. It just catches up to them. And what's super fascinating here is that the exact same repetitive overuse mechanism creates completely different diseases depending entirely on the geography of the body. Like, if the repetitive stress inflames the growth plate in the heel bone, the calcaneus, that's Sever's disease. But if the patellar tendon pulls repetitively and inflames the growth plate at the top of the tibia, right near the knee, that's Osgood-Schlatter's disease. Treatment for both of these basically involves resting from that aggravating activity, using orthotics or braces, and of course, physical therapy. And finally, Section 5, Assistive Devices and Mobility. Let's look at the implementation phase of the nursing process for all these injuries, mobility management. How do we keep these kids safe while they're healing? Applying assistive devices like crutches, braces, splints, or even wheelchairs, it isn't just an afterthought. It's a critical, totally practical nursing skill. You have to ensure proper fitting and actually teach the client how to use them to protect the injury. Getting them moving safely is paramount. It requires heavy collaboration with physical and occupational therapy and a really sharp eye to prevent things like contractures or bone demineralization. All of this while ensuring safe transfers and strictly avoiding any twisting of those injured extremities. So, as a future nurse, are you ready to use your clinical judgment to differentiate a minor bump from a limb-threatening emergency? The next time you assess a crying child with a swollen arm, I want you to look past the obvious bump. Ask yourself, what are those distal pulses really telling me? Your ability to spot the subtle difference between an expected symptom and a silent circulatory emergency won't just help you pass an exam. It might literally save your patient's limb. Keep questioning everything and stay curious.